Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Lagos government approves August 3rd for resumption of senior secondary school students. Only day schooling allowed. Cross River State celebrates COVID-19 free status as Governor Ben Ayade commends NCDC Federal Ministry of Health on the management of COVID-19 in Nigeria. And doctors' strike in Sierra Leone leave COVID-19 patients in some main treatment centers without care. As the nation starts to ease restrictions, a new rise in coronavirus cases is expected. Nigeria is recording a steady rise in cases, with total confirmed cases put at 27,110. 10,801 patients have recovered after 649 cases were discharged in the last 24 hours in 16 states. Delta recorded discharged 197 of those cases, Katsina 156, Edo 80, Rivers 39, Enugu discharged 38 persons, Plateau 22, Lagos 21, the FCT 20, Kano 19, Bayelsa 18, Kaduna 18 as well, Kwara 7, Gombe 6, Bauchi 5, Sokoto 2, and Borno State 1. But the death toll stands at 616. Lagos in the southwest remains the epicenter of the pandemic with 10,823 cases. The number of active cases in Lagos stand at 9,060. The FCT in the north central is next highest. It has recorded 35 deaths, while Kano in the northwest has discharged 977 persons. It's the fourth highest in the country. It has 1,257 cases. Edo leads in the south-south with 1,203 cases. Bauchi displaces Gombe once more in the northeast with 512 cases, while Ebonyi still leads in the southeast with 438 cases. A date has now been fixed in Lagos State for the resumption of senior secondary school students in their final year, and that date is August the 3rd. The governor, Babajide Sanwo-Olu, in a briefing today in Marina, Lagos, and says that only day schooling is allowed and no boarding school for now. Churches, mosques remain closed as he approved two categories for testing in the state. The first, those showing symptoms. Second, those showing symptoms who are to pay, of course, for the first. Those showing symptoms, testing is free. For now, about 13 laboratories have capacity to test for COVID-19 in the state, as the governor warns against testing for coronavirus by unaccredited facilities.
The nationwide curfew, which still remains in force between the hours of 10 p.m. and 4 a.m. daily, will continue to remain in force. Places of worship will continue to remain closed in Lagos for some more time in the future. All social and event centers, social clubs will also continue to remain closed for now. Schools and educational institutions will remain closed. We continue to support online teaching of curriculum during this period. However, students in the transitional classes who have the mandatory public examinations ahead of them will be permitted to resume for revision classes and, of course, for the examination. All educational establishments are to follow the established public health guidelines and protocols for the reopening. We just finished a very long meeting with various stakeholders in the education sector. That is what has kept us for the past 2 hours. And so for the avoidance of doubt, students impacted by these directives will be in the transitional class of JS3, SS3, and Tech 3, the teaching, the technical education schools 3 as well. The commencement date for this will be from Monday, August the 3rd, 2020. Monday, August the 3rd. For JS3, Tech 3 will be the first that will start. And for SS3 and Tech 3 will be the one that will start. But for JS3, we'll wait for another 1 or 2 weeks, and we'll see how we take in the first set of Tech 3 and SS3 before they now subsequently will open. This permitted opening will apply only to day schooling. No boarding activity of any sort are permitted at this time.
You're blocking the shop.
As the country enters the next phase of coronavirus management, the Cross River State Governor, Professor Ben Ayade, has commended President Muhammadu Buhari, the NCDC, the Federal Ministry of Health, the state's COVID-19 response task force for the skillful management of the pandemic. The governor expressed delight that the state has so far remained free of the virus, irrespective of being surrounded by countries like Cameroon and states with confirmed cases surrounding it. He was speaking during a meeting with the state's COVID-19 response task force.
We want to put on record that we are particularly grateful to the Federal Ministry of Health and to NCDC for being a great example, for playing a very professional, technical role and giving a world-class response to the COVID-19 pandemic. Nigeria has led Africa and have demonstrated full commitment and have shown a classic response. For us as a state, our own lockdown have just started. Because by opening our borders and by opening the airways, Cross River that is COVID-19 free will have an avalanche. I see it coming because at this point, we no longer have control over our borders. By today, we have surrendered to the supremacy of the federal government by causing us to open our borders. This message, therefore, is to say that you have our vehicles back on the road and the COVID-19 team back on the road. While the borders are open, our eyes will remain open. While the borders are open, our medical professionals will remain open. We must continue to stay on our borders. We must continue to police them.
And some states in Nigeria continue to adopt and revise measures to flattening the COVID-19 curve as the country records more cases. We begin in Plateau State, where the Chief of Staff to the Plateau State Governor, Noel Danjur, tested positive to COVID-19. Following the directive of Governor Simon Lalong that members of the state ESCO take the coronavirus test after 2 commissioners tested positive midweek. A statement from the Commissioner for Information and Culture reveals that results of the tests indicate that all other members of the state's ESCO tested negative except the Chief of Staff, who is asymptomatic and in good condition. It adds that health officials have commenced treatment for him at one of the isolation centers in the capital, while members of his family and other contacts are being traced and will be tested. Over in Kwara State, the governor has warned that relaxation of guidelines of COVID-19 should not be taken as an avenue to flout the directive to avoid COVID-19 spread. The governor said this while receiving 3 ambulance vehicles donated by a Kwara-based company. He noted that people should continue to adhere to the guidelines in COVID-19, urging them to collaborate with government and fight against it. Over in the South-South, the Bayelsa State Governor, Doye Diri, has directed the COVID-19 task force to intensify screening of persons at all entry points into the state, in line with the rise in the number of cases and the lifting of the ban on interstate travel by the federal government. Governor Diri also directed the permanent secretary in the Ministry of Health to come up with documents for the purchase of a biosafety cabinet for testing purposes for COVID-19. The governor gave the directives during an enlarged meeting of the state's COVID-19 task force at the government house, Yenagoa.
And provide them with contents which...
And Peter Annamarie is a pharmacist, also a member Association of Hospital and Administrative Pharmacists of Nigeria. He joins us from our Abuja studios. We'd like to thank you for joining us on the program. First, I'd like to begin by asking, what do you think about Cross River State? It continues to insist that it is COVID-19 free, but we've heard from public health practitioners who say that there is no state that is COVID-19 free in Nigeria.
Thank you very much for having me here. For any state or any part of the country to claim that there are no COVID-19 pandemics in their place it has to be based on testing, on reports from testing. If they have tested enough and and all the tests come out negative, we can believe them and we agree with them. But if they've not done enough testing to go around at least maybe 3/4 of the populace, and they are saying that the state remains free of COVID-19, then they still has to do more to prove to us that their claim is correct.
Now, looking at lockdown restrictions being lifted across the world, what kind of response should states put in place to avoid a spike in cases? For example, in a state like Lagos today, the governor says SS3 students can go back to prepare August the 3rd. Would you say that the teaching staff, non-teaching staff, would you say that they're ready to go back?
Well, I think the government has to carry out investigations as to how prepared the school are and how prepared the teaching staff and non-teaching staff are before lifting the lockdown on schools or returning students to school. They have to be prepared. They have to be encouraged to keep to the guidelines set by the NCDC on hand washing, on hand hygiene, provision of hand washing equipment around the school areas before they will be able to come back and resume school. If they've not done this, then they need to prepare more before they can call the students back to school.
And you said part of the preparations is testing, but are you happy with the pace? Lagos, where the epicenter in Nigeria, is adjusting to its 1,000 tests a day, now aggressively expanding that capacity. But across Nigeria, we're at almost 150,000 in samples tested. Are you happy with the pace?
I'm happy with the pace of testing so far being carried out in the country. As we've been told, we have over 40 testing laboratories in this country for now, and the pace is good enough for us.
Nigeria recorded one of the highest recoveries across the country, 649 in just 24 hours. Looking at our treatment regimen, would you say that that is responsible, or perhaps the age bracket?
Yes, the treatment regimen so far, as we have observed, is good enough and is responsible for the large number of discharges that we're having. Now, you know that some people can even resist the disease too. So the treatment regimen being carried out in this country so far is good enough at all the treatment centers so far.
We appreciate your time, Peter Anna-Marie, a pharmacist, member of the Association of Hospital and Administrative Pharmacists of Nigeria. Thank you for joining us on the program.
Thank you very much.
All right, Nigeria's federal and state governments have acknowledged the devastating impact that COVID-19 will have on lives and livelihood sources, especially the most vulnerable. In Ekiti State, pensioners are among the vulnerable group, and they're worried about the impact of the virus. Here's our correspondent from Ekiti State, Babajide Agbeyo.
Pensioners in Ekiti State are expressing their fears over their vulnerability at a time like this and the dilemma of some COVID-19 guidelines. They want to be included in special health schemes and other concessions that they are asking for.
Everybody knows that the elderly, they are the most vulnerable. When you are 70, 80, 90, you must have suffered from one ailment or the other. So the coming of COVID-19 now makes us more susceptible because it affects people with ailments more than people without ailments. Particularly trying to inculcate them into this national insurance system, because the earning capacity is very low now.
As Nigeria will gradually begin to set in motion its post-COVID-19 plans and projections, it is hoped that these senior citizens will be factored in. Babajide Agbeyo for COVID-19 Update.
A public health physician, Dr. Jamiu Ganiu, joins us right now via Skype from Lagos. We'd like to thank you for joining us on the program. I'd like to begin with the first question, and that is the role of community leaders, which has been said to be critical to the COVID-19 response. Do you think that there is sufficient community drive in raising awareness for COVID-19 sensitization, testing, contact tracing?
Thank you for that question. Actually, it has been our concern that the community leaders need to be involved. I remember I was part of the contact tracing, especially the acute case search during the early stage of the response. And I realized how important the community leaders are, in the sense that these are people that are so close to the people in the community. They command some of respect in the community, and I think people listen to them. So if these people are being used as role model, leading the contributing in terms of helping with the response, creating awareness, linking them, sensitizing them about available resources, the services in the community, I think it will go a long way in ensuring that we limit a kind of encourage compliance. And at the same time, it will also limit, some myths and misconceptions, since these are people actually respected in the community. So by the time these people play a kind of key role, people will actually assess some of those disbelief. And as well, it will also help them to be able to kind of, believe in what is happening. And in so doing, that might create a kind of awareness, so that people can actually believe in all what has been an issue all along with regards to the lack of compliance. Thank you.
Dr. Ganiu, what's your take on the pace of Lagos State? We heard from the governor, his briefing, how, SS3 can begin August 3rd. We're looking at ramping up of testing capacity, but it's still recording daily rise in cases in the city.
Yes, as I said, I've been, all my concern all along has been the issue of us a kind of spending more effort on preventive measures. How do we ensure that people comply? The other time I mentioned that some people, that no matter what you do, they will not comply. So we need some level of enforcement. And this has to do with clear understanding with the general populace, without actually spending more effort on preventive measure. I'm sorry, we may continue to record more cases. I agree, we need to scale up testing. We need to build more isolation center. We need to partner with the private sector. But I think we need to really work on our preventive measure. How do we ensure people comply with all the preventive measures? Because if you look at it, even at the beginning, after the phase 1, we still had issue with lack of compliance. At the end of phase 2, the same thing. So I'm a bit worried about other, easing out, like the issue of, opening the airport, school, and so on. I think we need to still work on the issue of preventive measures. How to ensure people comply. And I'm even a bit worried, like with the airport, we've said a lot of things about that. You see, at the beginning, we are very good on paper, a lot of good guidelines, paperwork and so on. But my worry is that when it comes to issue of compliance, that is when the issue will become. At the beginning, actually, people will comply. But the sustainability issue has been the issue. How do you sustain the idea of people complying with all these measures? That has been the concern. We have been worried about the cases, but it has to do with actually the number of testing. It has actually scaled up. But we still need to, spend more effort on preventive measures. How do you ensure people comply with all the preventive measures? Thank you.
All right. We'd like to thank you, Dr. Jamiu Ganiu, public health physician. Thank you for joining us on the program.
Thank you very much.
Now, a doctor strike in Sierra Leone has left COVID-19 patients in some of the main treatment centers without care. The doctors say they were promised hazard pay for their work during the outbreak, but have not yet been paid. The strike marks an escalation in a row between doctors and government over what doctors say is a misuse of funds for the coronavirus response.
Any patient that is showing COVID-like symptoms will not be attended to by any doctor. That is the decision.
This is the plight of COVID-19 patients as doctors treating them are on strike. Doctors in Sierra Leone say they were promised hazard pay for their work during the coronavirus outbreak, but that pay has not come. They also complain of a lack of protective equipment like gloves, masks, and coveralls, vital to prevent infection spreading from patients to hospital staff. However, they still remain at work, but just for non-COVID-19 patients.
But we still remain in the hospitals attending to non-COVID patients. So in other words, we are still part of the hospital settings, but we are outside the response at the moment, owing to the fact that our allowances are not paid as per MOU.
No new patients are being accepted because the 5 doctors at the 200-bed facility are all on strike, leaving community health workers and nurses to care for the sick. Dr. Jusu and other staff acknowledge that this could lead to a rise in cases in the community.
If doctors lay down tools, then most of the corona patients will go out of the treatment centers. And secondly, those who will be diagnosed of the disease will not come to treatment center because they know doctors are not there. So they will, in fact, embark on this self-isolation, which is a mere risk.
Since the outbreak began, according to procurement reports released by Sierra Leone's Finance Ministry, the only medical equipment listed was 8 ventilators, which cost approximately $82,285 out of 20% of the country's total coronavirus expenditure.
And the European Union has approved the use of remdesivir for treating patients with COVID-19 within the bloc. Let's bring you our global update.
In the United States, with 53,000 new cases recorded on Thursday, the U.S. set a new one-day record for new infections. As a result of the steady rise in cases, July 4th Independence Day will look very different this year than the usual huge public firework displays, massive parades, large family reunions, and backyard barbecues. Cities around the U.S. have canceled their annual parades as cases of coronavirus continue to rise in 37 out of 50 states, leading governors to roll back their plans to reopen. In Italy, 11 tourists from the United States were rejected from entering after they arrived at Italy's Sardinia by private plane on July 1st. This comes after an earlier decision that the United States is not on the list of countries whose tourists are allowed to enter the EU starting from July 1st. In 2019, the total number of U.S. tourists in Italy was 4.4 million, spending 5.5 billion euros. In Spain, Antonio Gaudi's extraordinary Sagrada Familia, or Sacred Family in English, temple in Barcelona was disinfected today as it prepares to reopen its doors on Saturday, July 4th, with strict anti-coronavirus regulations. The unfinished temple, which combines Gothic and Art Nouveau styles, will reopen after 3 months in 3 phases.
The NCDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory on the disease. Of course, the live feed of the World Health Organization's website has regular updates on the spread of the pandemic. WHO, the global COVID-19 strategy, guides the public health response at national and subnational levels. You can also take a closer look at our website, channelstv.com. It has the latest updates, news from Nigeria, Africa, and the rest of the world, all at your fingertips, channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. You have another update at 9 p.m. today. Stay healthy, stay safe.